Hello, I welcome you all for the new episode of Meet the Knee Expert. Like every month, we have Dr. Parag with us to answer all the burning questions that all of us have about knee health overall. Thank you, Dr. Parag, for joining us today.
Thank you. Thank you so much.
So winter is here, and so is the season of marathons. And there are so many budding athletes and budding marathon runners who are taking up marathon because that's the flavor of the month. And that's the reason why I wanted to ask you a lot of questions about common injuries in marathon runners so that all our viewers can practice safe running techniques and stay injury-free throughout this marathon season.
Absolutely. Yeah, so as you rightly said, this is the season when there are maximum number of marathons and, I've been getting so many patients in my OPD who ask me all the questions related to marathons. And in the next 15 minutes, let's see if we can answer some of them. So first of all, which are the main joints which can get injured or which can cause pain while running? So they are the knee joint, the ankle joint, the shin, the heel, and the structures around the knee. So that is what can cause essentially the pain while running.
Gotcha. So, for all the joints and structures that you mentioned, what are the most common injuries that you see in your practice where marathon runners suffer from?
Yeah, so that's an excellent question. The most common injuries we see, or the most common site of pain, I would say, in runners is the knee joint. All of them have some kind of knee pain, and it is important to understand that there is not a single cause which causes the knee pain, not a single structure, or a single reason. There are multiple reasons why a runner can get knee pain, and it is important to identify that reason and then treat that particular reason so that the person can get back to running.
So I would like to pick your brain a lot more about knee injuries, but before that, how can a runner identify or differentiate between a soreness or just a temporary discomfort versus something that is a symptom of a more severe or a serious injury?
Excellent question. This is what happens, So soreness and a little serious knee injury, these are completely two different things. And first, let me just say that soreness is something which will eventually recover, and serious knee pain due to some underlying cause probably will not recover. So soreness in first 48 to 72 hours will go. You'll start feeling more comfortable. In soreness, generally there is no one area of pain. Usually the pain is all around. Also, if you take rest, you put ice, you suddenly start feeling a lot better. Versus if you think of a serious knee condition, or something which is caused by an underlying pathology, then it is a very localized site of pain. Even with rest and icing, the pain doesn't go completely, and the pain continues even beyond 72 hours. So that is the essential difference between soreness caused because of running and some kind of a more serious pain because of internal derangement of the knee, or what we call as an internal pathology of the knee.
Alright, thanks. So you said knee is the most common joint to get injuries because of running. I would want to understand why is that?
Yes. So the knee, as I said, is the most commonly injured knee while running. And the reason for that is because of the complex anatomy of the knee. Unlike the hip joint, which is just made by a ball and socket joint, there's nothing much to it. But the knee joint is made up of three bones: the lower end of the femur, the upper end of the tibia, and the kneecap, which sits in front. Additionally, there are two ligaments in the knee, two ligaments outside the knee. ACL, PCL is inside, and the medial and lateral collateral is outside. Plus, the articular cartilage, which is covering the knee, is very, very prone to injury. That is the coating of the knee. Next, we have the menisci in the knee. The meniscus is the shock absorber of the knee. That can get injured. Then, we have the tendons, that is the patellar tendon, which gets inserted from the kneecap to the proximal part of the tibial bone, that is the tibial tuberosity. That can be a problem. Then there can be other insertional pains. There are bursae around the knee. The bursa around the knee can get inflamed. So due to the complex anatomy of the knee, there are various reasons why this knee pain happens. And we have to be very careful as a doctor, as a physician, as a sports medicine specialist. I have to be really careful in making an exact diagnosis. If I do that, then I can treat that condition and the patient can get back to running.
Sure. So, in today's easy access to knowledge overall, whenever, let's say, I have a problem, first thing I'm going to do is Google about it. And there are very loosely used terms like runner's knee, jumper's knee that Google throws at your face and says that this is what you should do. Can you explain our viewers what exactly are these issues?
Exactly. This is a very good question. So essentially, the runners, let's talk about runners. And I'm just talking about typical running. If you have an injury, if you have a sports injury while playing football, rugby, kabaddi, or if you have a fall and you injure your knee, let's leave that particular, section out. This is typically because of running. And sometimes, people just suddenly run a lot and then that causes knee pain. So typically, what can you get? Number one is what we call as the jumper's knee. The jumper's knee is nothing but the pain at the patellar tendon, where the patella from the lower part of the kneecap inserts onto the proximal shin bone, that is the tibial tuberosity. So that tendon can get inflamed and then that can cause the pain. So that is called as the jumper's knee. Then you can get what is called as the pain behind the patella. So that is we call as the typical runner's knee. So the pain behind the patella, where the patellar cartilage, which is usually firm to hard in consistency, becomes soft, then you get the pain, that is the runner's typical knee, that is chondromalacia pain. So because of chondromalacia patelli, that is a very common condition which causes pain in runners, and it is also called as runner's knee. Then the other kind of pains is because of the meniscus. What happens is the meniscus, because of running and improper footwear or the surface on which you are jogging, repeated stress on the meniscus can cause it to tear, and you can get meniscus tears even in these running injuries, chronic running injuries. And the last is sometimes you get stress fractures around the knee because of repetitive minimal trauma on the shin bone or sometimes on the meniscus or any part around the knee. You can get a stress fracture. So these are the various reasons why one can get pain in the knee or around the knee while running. And we have to very clearly as clinicians differentiate between each of these conditions, and there are ways to do it, and we can pick up the exact diagnosis and then make that person well, and so he can continue the season and do running.
So along with that, a lot of people complain of pain on the outer side of the knee.
Yes.
So what is the cause of that mean?
Yes. So there are two types of pains here. One is the outer side of the knee. That pain is called as the IT band friction syndrome. And one is on the inner part of the knee, that is called as the Pellegrini-Stida disease. So the outer part of the knee where the pain comes is because of the structure which is called the iliotibial band. The iliotibial band is a firm band which you can actually feel on the lateral side, and that inserts below onto the proximal part of the tibial bone. And when it crosses the knee, especially in the lower third femur and the exact knee level, it can get inflamed and it kind of rubs and causes friction along the bone and the underlying structures. And every time you run, that friction happens and you get pain. Sometimes in serious injuries, it is also called as the IT band snapping syndrome. The IT band snaps. So that is the pain on the outer side. The inner side, what happens is the medial collateral ligament and the insertion on the femur, on the thigh bone, it sometimes undergoes a little bit of inflammation, and then that can also cause pain. But the pain on the outer side, as you said, the IT band friction syndrome, is very common and very often seen in the runners.
All right. Thank you, sir. So let's say some of our viewers might be experiencing these symptoms right now, or they might be undergoing recovery right now. What do you, how can they decide if they should continue running, they should stop running? What do they need to do?
Exactly. So very good question. And if you wouldn't have asked it, I would have told you to ask me. See, what happens when any person, I don't want to call him a patient, because when you call a runner a patient, it was like it. So any runner, let us say, a runner comes to me and asks me, Doc, I've been running and now, my marathon is coming. I'm on 14 December. I have to run the marathon. So what can I do now? Should I continue or not continue? So to answer to that is to come to a diagnosis. So for a diagnosis, I would say I need a proper clinical evaluation. I need an X-ray and I need an MRI. So these are the three things. And in that particular order, you cannot directly send the patient to an MRI. First, clinically see him. Where is the pain? Medial side, inner side, lateral side, which is the outer side on the joint line or at the patellar tendon or proximally or wherever. So then you can actually pick up the diagnosis clinically. Then you take an X-ray and you can see on the X-ray sometimes, there is a little bit of stress fracture and that can be another cause of the pain. And the third thing is you do an MRI. And MRI, if you get a 3 Tesla MRI done nowadays, it's quite sensitive. It picks up the injuries to 92% sensitivity and 96% specificity. So that's how accurate an MRI can be. And then you see in the MRI, whether it is a patellar tendon inflammation, whether it is a chondromalacia, that is the runner's knee, or is the meniscite tone, or is the IT band syndrome. So that can be differentiated. And if whatever the condition is, let's say now, if it is a meniscus tear, then of course that particular runner should understand that it's going to take time to heal. It's not going to heal in the next couple of weeks, or for that matter, couple of months. It may require arthroscopy. And then he should forego that particular forthcoming marathon and then train for the next season. It's not that he's completely out of it. The second is this patellar tendinitis, what we call as a jumper's knee. That if you give rest, icing, anti-inflammatory for a couple of weeks, then it gets all right. And then if the marathon is a few weeks away, he can still complete the marathon. Same is the thing with jumper's knee. Same is the thing with runner's knee. So runner's knee also with rest, with NSAIDs, with proper icing and doing a lot of this tapings, it definitely helps. And then the runner can continue the season and finish the marathon. But if there are some stress fractures, if it is a very serious kind of a IT band snapping syndrome and it is not going away with rest within 10-15 days, then it is better that the runner misses that particular marathon, misses that season, and then comes back in the next season fully cured, fully prepared, and he can, I'm sure, very successfully complete the next marathon.
Thank you, sir, because that's a great insight for all our viewers that just nobody likes to let go of an event what they have been prepping for. But like you said, if it's a stress fracture, if it's a tear, and if they continue to train, they might just end up damaging it, which could be way worse than what it could
Absolutely, because I've seen, if I've picked up the stress fracture early and have told the runner to stop, it heals. And people are, sometimes they are very focused and very passionate that they have to finish the marathon. There is a little bit of a competitive spirit, there is a peer pressure, and so many other things. So they try to finish it. And then I have seen patients who come back with a complete fracture of their stress fracture, which would have been easily managed just by a plaster. And then we have to actually operate and put a plate. So a stitch in time saves 9. So if there is a pain which is not getting relieved within a couple of days of stopping of running, and it is in fact aggravating, then it is better you consult your knee specialist or a sports physician or a physiotherapist, who will be able to diagnose it and, suggest the further line of treatment.
Thank you so much. So in all the episodes that you have done, you have always spoken very highly of prevention of these injuries.
Absolutely.
And for all our budding athletes who are taking up running, can you share with them some preventive techniques so that they don't have to go through all this trauma of injuries?
Of course. And I wasn't sure you would ask that question, and you did. So as they say, prevention is better than cure. So there are many things runners can do to prevent knee pain, shin pain, ankle injuries, and all of that. And if they follow these tips which I'm going to give now, I'm sure most of the times the knee pain, the ankle pain, the shin pain can be prevented. So first of all, proper warming up and cooling down. So before starting your run, suppose you are training for a marathon, just initially do 5-10 minutes of warm-up exercises. And when you finish the run, just suddenly don't go back home or don't start your work or what is your next activity. Just relax, do some stretching and cool down. If there's a possibility of some kind of an ice bath, when you get to some serious training, ice bath cooling down I've found is really very good. So that is about warming up and cooling down. The second is slowly progress. You may be running a 42 kilometers marathon. So don't start on day one running up to 30, 35 kilometers. Slowly progress. Today you do 10, next day you do 15, 20, and then gradually in probably 4 or to 6 weeks time, you go to your final destination of 41 kilometers, 42 kilometers, or some of you run half marathon, whatever it may be. So slow progression of your target. The third is simultaneously just practicing running is not enough. You have to train your own body as a whole. So of course, keeping a cool mind, keeping a proper sharp mind is important. In addition, training your other muscles. So strength training, I feel, is very, very important for running. So changing your activities and then doing something different instead of running that day. So what different things can you do? Number one is swimming. Because swimming, you don't put weight. There is no impact. So swimming is good. Cycling you can do. Cycling is a very good activity as a cross activity from your daily training things. And then going to the gym, doing the strengthening and, making sure all your muscles, not only the lower limb muscles, but also the upper limb muscles are strong enough to support your 21 or 42 kilometers marathon. The next and most important thing I would say is footwear. And many times, runners ignore this. They say, what is there in a footwear? But I say, invest in the good footwear. Footwear which has a good padding, which absorbs your shocks while running. It takes all the impact and thereby prevents injuries. I can very, very definitely tell you that if you use a good footwear, the injuries around your leg, knee, ankle will be much less as compared to if you use just a regular footwear. So invest in a good footwear. All I can just to give you a comparison, what you might spend for 2 dinners, if you put in a good footwear, that's enough to get you a nice pair of shoes. The next important thing is the surface, the terrain where you run. So of course, when marathons are usually on tar roads, but while training, use some ground. Don't start directly running on a tar road. Use a ground or use other kind of surfaces which are not directly tar road and start with that. The next is the technique what you use. And there are various techniques. For this, I would say that you should take some advice from a fitness trainer or coaches who will tell you the exact technique of running, because the movement of the hand, how you land, the impact of the heel when you land, when you take the push off, the heel strike, all that is very, very technique and, biomechanically dictated. So I think that is the important thing, and it varies and you can talk to the expert in that. Then if you have some kind of knee pain, ankle pain, then you should use protective gear. What is that? You can use various kinds of knee braces, knee supports, knee caps. You can wear shin guards if there is a possibility of a stress fracture. Then you can wear something in the anklet, the ankle binders, the ankle braces, or then you can use extra support in your footwear as well. So that is all about the protective gear which you should do. And last but not the least, listen to your body. Your body is signaling you. Your body is telling you, please stop, please stop. And you just, because of your own passion, because of your ego, or because of competition which is coming, you continue to run in spite of the body signaling you, and then you get the injury, you get the problems which I have enlisted before, and then sometimes it's too late. So listen to your body will tell you a lot, and then you can prevent these injuries. And God forbid you do get an injury, then I would say is early medical help is go to a doctor, go to a sports medicine physicians. And we at Sancheti Hospital have a great sports medicine lab. We do a lot of investigations, training to help you to run a good marathon.
Thank you so much, sir. I'm very sure all the information that you have shared with us and our viewers today, it will really help them get into running as a sport in a right way, so that they don't land up with injuries because of which they have to stop running. So thank you so much once again, sir, for giving us your valuable time.
Thank you so much, Saurabh, for once again inviting me in this Meet the Knee Expert program. It's always fun to be here and chat with you and the audience who are hearing me. So friends, as I part, the message is the marathon season is around the corner. But be safe, follow all the tips I have told you. Don't be overzealous. Sometimes, listen to your brain rather than your heart. Don't take emotional decisions. And completely trained in all aspects. What I say is the mental and the physical. For the mental aspects, you need some kind of meditation to keep a good, calm mind. And then, of course, physical training. I've told you about the various ways, the strength, strengthening, running, progression, and all of that. So, wish you a very happy running, and I'm sure you're going to achieve all the targets you set for in the forthcoming season for your marathon. Thank you.